at hospitals, at clinics? Are there things in place for mothers who are experiencing or might experience postpartum depression? Hey everyone, I'm K.A. Will.
And I'm Gabby.
And we are K&G Culture. And we came up with that name, as you know, because we realized that we are responsible for the culture in our household. Yeah, the way our parents brought us up may have some effect on it and influence it. Yeah, our background influences it. Culture and media influences it. But ultimately, it is our decision. It is our responsibility for the culture we have in our household. Like the morals that we teach or we live by, the decisions that we make, finances, all of those things are our responsibility. And we hope that this podcast influences you guys to engage and have conversation with your spouse on the culture you want to have in your personal homes.
Yes, so today at our episode, we're going to talk about postpartum depression, which I've experienced before. Excuse me. So, and we know that it's not talked a lot about. I'm glad that there's more light shed on it, but still there needs to be more campaigns and conversation about it. Kareem and I, before we had Shyla, talked about, or he definitely implored me to let him know how I'm feeling. If I felt anything different or depressed or at all while having, after having our first child, to screen for postpartum depression. As you may not know, patients or women who have depression are at higher risk of having postpartum depression, or if their family members have parents have a history of depression, are higher risk of having postpartum depression compared to women who don't. And so because I had undiagnosed depression, we both, that'd be a great idea to look out for, to be aware.
Yeah. No, I was just going to say, just touching on what you just said, I guess my first question as we get into the topic is, what causes it? And, I know it comes with being pregnant or after giving birth. But what, I guess, chemically, mentally, what are some signs we can look for, that kind of thing?
Okay, so there's no one cause for postpartum depression. Same thing, like there's no one cause for major depressive disorder. We call it multifactorial, so different factors are affecting it. It could be hormone changes, and again, history of depression. What was I going to say? The stress of having a baby and the body and chemical and hormone changes that happen with that all contribute to postpartum depression. But that's why it's important to see if you have risk factors, to discuss that beforehand and say, all right, these are the things that we need to be aware of. So things to look out for, not just fatigue, because, we just had babies, but more severe fatigue, decreased energy, not wanting to get up, not having negative feelings about the infant, about your baby, that of course you don't want to have, but these thoughts are coming in. Negative thoughts on how you're raising the baby, like feel like you're not able to care for the child on your own, care for yourself, not being able to laugh if there was something funny, like, if you're tired, but you're watching the television episode and something funny happened, you could laugh, but patient with postpartum depression might not find it funny or just not laugh at all. So gotcha. Decreased emotion, not wanting to do, not feeling enjoyment in the things that they used to find enjoyment in.
These sound like very similar signs like regular depression.
Correct.
Yeah.
Yep.
Okay.
Correct, for sure.
Gotcha.
Feeling overly guilty about things, or worrying too much, too anxious. So there's and thoughts of suicide or thoughts of hurting the baby. That's on the severe side. So very, very similar to depression, and and similar to, like, again, being fatigued from having a newborn, but just making sure that you're diligent and saying, okay, how are you feeling today? Asking each other, how are you feeling today?
Right.
And being honest and not feeling ashamed for your thoughts, even if they're negative and something that you wouldn't have otherwise if you weren't going through postpartum depression.
Okay, gotcha. Are there things in place, like at hospitals, at clinics, are there things in place for mothers who are experiencing or might experience postpartum depression? Because I'm asking because we really don't hear about, oh, this is available to you.
So, from my experience, we give the Edinburgh scale or screening questionnaire after having maybe right before discharge, and then again at 6 weeks to screen mothers for postpartum depression.
How long has that been around, if you know?
The Edinburgh scale? No, I don't know.
Oh, okay. Maybe somebody can leave that in the comments, let us know, or we can Google it after and figure it out. But I'm just curious to know, like, because I don't think they were doing that always, if that makes sense. Like, say in the 80s, 90s, whatever. It might have started in the 90s, who knows?
Right.
But I don't think they were screening, like, right after birth. Hey, how are you feeling? Do you feel depressed? Do you feel tired, like you said, lonely, or negative thoughts? So that's why I asked, because I don't know how long they've actually been doing that.
Mm-hmm. So if a mom is higher risk or scores, is higher risk, then I believe they get social work involved or watch her closely. Maybe her 6-week postpartum appointment is moved up.
Oh, okay. Gotcha.
And then, of course, therapy.
Gotcha.
Referrals for therapy, all that stuff.
All right. So now more of like a personal question. After we had Shyla, which is our firstborn, did you know right at that time that you were experiencing postpartum?
Nah.
Okay.
So when we had Shyla, I was ending medical school and then had a month or two off and then started residency. So I'm pretty sure that also contributed, again, multifactorial, the stress of changing our lives around and then now going to something more strenuous, residency as far as work hours. So I feel like, I don't know when I developed it, but I remember thinking, you know what, I'd be okay if I ran into while I'm driving, I'd be okay if I ran into the wall.
Wow.
Or I would be okay with being gone. And so I think my attending, I don't know, he asked me how I was doing, or we had this one-on-one conversation because he was my mentor as well.
Right.
And I was like, he's like, have you, man, I forget what question he asked, and so then I told him that I was having passive suicide thoughts. But he was like, oh, that's serious. You need to go get checked out.
Oh, okay, so that part I remember.
Yeah, and this was probably 9 months after having Shyla.
Wow.
It is a slow progression for me, at least. Because yes, I was tired, or the baby waking up in the middle of the night multiple times. You can't console them back to sleep, and I'm drained, even though I don't have to go to work.
Right.
Yeah, that happened, and then she slept on her own, or slept all through the night at 3 months. But then
them first 3 months though, my God.
Yeah, it sucked. Not for her, but it sucked for me.
Right.
Just kidding, but So yeah, I was like, oh, that's normal. And then residency came, and I was like, this is never going to end. This is never going to end.
So, something you just said, right on the same vein, does it feel normal to the mom? Like, what I mean is, not that, how do I want to say it? Not that, they've always been depressed, but because of how they currently feel, they think that that's normal. Sure,
I would think so, because it's underdiagnosed. So I'm pretty sure that
So I think I asked that because that's probably one of the dangers of it. Like almost like, how people say we have silent killers or silent things that go undetected that harm us. That's what this sounds like to me. Like, because a mom is just thinking, like you said, I'm just tired. This is really hard right now. Oh, I have school, I have work, I have the baby. And after a while, it just feels like it's supposed to be that way. Like, oh, this is normal.
Right.
Not knowing that it's actually being, causing depression or you are depressed.
Right.
Yeah.
Yep, I agree.
And
then I see, looking back, I can see where I felt guilty because residency hours are no joke, and I can't pick her up on time. And you were gone during the week for work, so I was on my own, not on my own, but taking care of her on my own, and had to drop her off at her grandmother's and pick her up late, or don't see her at all and ask can she sleep over, and then wake up early in the morning to get her ready to drop her off at grandma.
Wow.
Yeah, so I felt guilty for not being there, and I feel like, and again, excessive guilt is a problem I have. I'm like, oh, we're not close because I wasn't there when you were a baby. I couldn't pick you up, or you had to spend some time at your grandmother's, and she loves her grandmother, right? Like, because that basically was her mom at that time.
So how else, dealing specifically with postpartum, do you think it actually affected your relationship with Shyla at that time? Not that it didn't affect your relationship with her at the time, but do you think it still affects your relationship with her now? The postpartum that you had at the beginning?
Well, I don't feel depressed anymore, so I feel like we're close. I love on her. I think maybe from her perspective, of course she does want to be with her grandmother, be with you, because she see you guys, or spend time with you guys more. Like on the weekends, if I had to work, they were with you. She was with you. But we'll see. We'll see. I hear that kids are don't remember a lot of stuff, and they're resilient. So maybe again, it's just me. Like I said, it's projecting my guilt, thinking that's what she's feeling, and that might not be what she's feeling at all. She might just be a daddy's girl, or she just loves her grandparents, which is totally fine with me. I love that, but I just wonder.
But what about you personally?
Just
the effect of the relationship. How do you feel about it?
No, I don't think so.
Okay, got you. Well, just like how you didn't know, I definitely didn't know that that's what you were experiencing.
Right. As much as we talked
even
about
though,
it.
yes, that's what I was just going to say. Even though we talked about it before getting pregnant, we talked about it during the pregnancy.
Yeah.
I legitimately thought that you were tired. Because I was tired. Like you said, like, Shiloh was one of those babies, like, you had to rock her to sleep. I remember that vividly. Like, you had to hold her and rock her.
Because if you did it and you try to wrap her up, her eyes are
right.
Eyes
we over there swaddling, and she's looking you dead in your face while you swaddling her.
It's like, hey.
Right. Like, what we getting ready to do?
Exactly.
So, yeah, I remember that vividly. So then you would rock her, but then you put her down. She might stay sleeping 5-10 minutes, but then she's up. You got to pick her up again.
Of course.
Rock her. So for the first 3 months, that's what we did. And then we sleep trained, of course. That's the only way we got her to sleep through the night at 3 months. And I encourage every parent, especially if you have a physically demanding job or a mentally demanding job.
And you could tolerate the cries.
Right. Yeah.
Because you have to tolerate the cries.
You got to tolerate at least some crying. That's the only way you're gonna sleep train them, because they have to realize that they have to learn how to self-comfort as well, or to know that you're still there for them even though you're not holding them. So that's the lesson in that. But not to get off topic, but yeah, I just remember being tired. So I thought you were tired. I was mentally drained and maybe not in a space to understand what you were going through, because like everybody says, once after you have the child, even if you don't want it to feel this way, everything is about the child. So everybody's focused on the child. Dad is focused on the child. Mom is focused on the child. And that's where neglect between the two of us can happen. Self-care neglect can happen. So I just thought you were tired. Like, I remember, and like you said, we were transitioning from med school to residency.
Mm-hmm.
So schedules changed again.
Every 4 weeks.
Schedules changed again. Schedules changed again. So it's like schedules are constantly changing, and now we have a baby in the mix.
Yeah.
So I was not, and I wish I was, like, I was not aware as I usually am to notice that was what you were going through. Because I remember you, like, laying down and being tired. I remember you, like, looking sad, but looking sad can look tired as well. Like, it's just a whole mixture of things where I'm just like, man, my baby is drained. I thought you were drained, but I didn't think it was depression or postpartum depression.
Yep.
So it's very hard to see those things.
And it's hard to speak them, right? Who's gonna tell you that?
Yeah. I have
like,
postpartum.
or I feel like hurting myself, or I wish I wasn't here.
Right.
Because then you sound ungrateful, or what's wrong with you? Blah blah. This supposed to be a happy time. Blah blah blah. But
I do remember this though. So I remember when you told me that you had the conversation with your attending, and that was like the first sign for me, like, oh, it's a little bit more serious than I thought, or even making me aware to that something was going on.
Yeah.
Because I remember when you said you had that conversation with your attending, and then you scheduled time for therapy.
Yeah.
That I remember, but all before that, like, for me, it's a blur. It's more like we were just so drained and tired.
Trying to survive.
Yeah. So, okay.
Now that I think about it, my first residency rotation in residency was OBGYN, and
Yes.
that was a overnight.
Yes.
That was overnight. And again, Kareem was gone during the week, so you could have
Seen everything.
exactly
Or sensed everything.
right.
So I have another question. Usually, for mothers, if there's a span, how long after the birth does postpartum start to occur? Yeah.
Traditionally, 6 weeks to a year can happen before.
Mm-hmm.
And again, if you're higher risk of having depression, or there was potentially some controversy over having the baby, you know, that increases your risk. Yeah, so you might have some issues before.
Gotcha. Because I think I've even heard of cases where it can happen immediately after, like, birth. Like, the mom is such in her mind is such in a tense state that she doesn't even want to see the baby after birth, like right there in the hospital. And man, my heart goes out to mothers that I just can't imagine what that feels like. And that's your baby, came from your body, and like this chemical imbalance or this mental struggle that's going on. Mental illness is real. So that going on within your body is causing you not to want to see your child. You know, it's just one of those things, and why we have to talk about it, why we have to be so aware of these things that happens as our bodies change, as our families change, as our schedules change, different pressures and responsibilities of life. We have to talk about this stuff.
Right.
Yeah. Is there anything else? Oh, okay. Well, before I say anything else, can we talk about what are some things you can do once you realize that you have postpartum? Like, how can you combat it? What do you prescribe for it? That type of deal.
Tell someone. Take inventory of how you feel. Don't be ashamed about it. Sorry, I'm not feeling. Oh, that's some congestion. Sorry.
No,
So, yeah, talk about it, tell someone, write it down, give it to someone if you want, write an email, give it to someone if you don't want to say it verbally. And preferably your provider, so that they can get you the resources, have a social worker work with you to get you therapy, start you on therapy, or if it's more severe, prescribing medications. But just the first step is like taking inventory, seeing how you feel, not being ashamed of it, just saying, all right, this is exactly what it is. Because those feelings and thoughts can be so passive that you don't realize until too late or later, until it's gotten so severe. So it has to be intentional. And
and just a quick recap on what you said. Some of those feelings, like not feeling yourself, not feeling like you love yourself, not feeling like you love your baby, feeling guilty, feeling shame, things that used to make you laugh don't make you laugh anymore.
Things you used to enjoy,
you don't enjoy them anymore. So at least you know what signs to look for. Sleeping all day in bed is also another one. I don't want to leave that out. Staying in dark places, not eating properly, these type of things. So yeah, take inventory of all these things. Your daily routine, just keep it in check. And yeah, talking to somebody. And like Gabby did, I highly recommend finding a therapist that deals with postpartum depression, or at least depression. That would really, really, really help. So yeah, I wanted to end with something else, but it escapes me right now. But I think it's good to end with letting people know that you can go and get help. Be honest and truthful on your screenings.
please.
Yeah, when your doctors ask you how you're feeling, this is your chance to let it out. This is your chance to release it, to deal with it, because when you go back home, you have to deal with it personally without the doctors being there, without the help being there. Be careful with, I guess, who you tell it to can be important, because you can potentially tell someone that can't really help you. So be careful to who you tell about. Tell what you're dealing with. Tell them about what you're dealing with. Make sure it's someone that loves you and cares for you, or someone that is professional that can help you.
Right.
Yeah. Anything else?
No, man. Be safe, women. Be safe, mamas.
Yeah. And yeah, you're meant to be here. Your baby's meant to be here. Birth in itself is a miracle. So we want to thank you guys, our culture family out there, for tuning in to another episode of Marriage Journey. And we know that this topic is important, and we pray that you have learned something from it, that you engage in the conversation with your spouse and loved ones, and go create your culture. Later, guys.